I want you to close your eyes for a moment and think about your grandfather, uncle, or someone like him. Let's call him Ed. Do you have a picture of him in your mind? Let's say Ed is 76, a widower that lives alone. So one day, when he feels unwell and lightheaded, he decides to go to the emergency department, just to be safe. There, he has a physical exam, they run some labs, and ask him about his medical history. Doctors are unable to identify the cause of his symptoms, but treat him and admit him to the general floor for further evaluation. Unfortunately, it takes 5 hours to get a bed ready because it needed cleaning. Then, he is not checked on right away because the doctor is making the rounds. When the doctor arrives 2 hours later, Ed is in bad shape. His heart rate is fast, his blood pressure is low, and he is confused. Things move fast now. He gets an IV, and a rapid response team is called. Ed is transferred to the intensive care unit, where they find that he has a urinary tract infection that has traveled to his bloodstream. Ed survives, but he is discharged to a nursing facility because he is no longer able to take care of his daily living activities. What if I told you that this was a true story? And what if Ed was your grandfather? How would you feel? You would probably feel angry, maybe a bit helpless. Why didn't someone get him the right treatment more quickly? However, there was no wrongdoing here. Despite receiving treatment according to best practices, Ed found himself in a life-threatening situation because of issues outside of his own health, such as unavailable hospital beds and lapses in communication between providers. Unfortunately, Ed's story is not unique. I work on precision medicine. The goal is to give the right treatment to the right patient at the right time. However, this problem is even harder than it seems when we recognize that a person's physical health is impacted by so many factors beyond their personal attributes. So while precision medicine is about the individual, we cannot truly understand individual health without considering the whole population and vice versa. To do this, let's look at the social determinants of health. The social determinants model is a framework for understanding the range of factors that influence health and well-being. Thinking about things in this way helps us paint a complete picture of the factors that can play a role in our health, including the environment around us. There are many versions of this approach, but all of them show an onion with nesting concentric circles and connections between them. The rings of the onion are made up of individuals, families, communities, and the social and economic environments that surround them, and they all influence each other. Let me now give you an example from my research. I work on a project related to diabetic retinopathy, which happens when diabetes damages blood vessels in the retina. It can cause vision loss and blindness. Diabetic retinopathy, or DR for short, is the leading cause of blindness for working-age Americans. What's the problem? One issue is that DR is difficult to detect and manage due to varying progression rates and because the disease doesn't show symptoms in the early stages. Another problem is that while the number of patients is increasing, the number of ophthalmologists are decreasing, so that eye care providers are near capacity. The good news is that blindness from DR is highly preventable with early screening and treatment. In fact, early detection, timely treatment, and appropriate follow-up care reduces the risk of severe vision loss from DR by 95%. Unfortunately, less than 50% of people with diabetes follow the recommended screening guidelines. Thus, our goal is to create personalized, that is, for the individual, and scalable, meaning that they will work at the population level, screening strategies for diabetic retinopathy. How do we do this? We create analytic tools using methods such as AI, machine learning, statistical models, and computer simulation models that predict uncertain outcomes to try to improve the process from end to end. First, we try to improve the accuracy of screening devices themselves. However, this still requires patients to come in annually. Thus, instead of widespread screening recommendations, we try to identify highest risk individuals using their past medical records. Thus, providers can focus on who to bring in. Lastly, because patients don't always come in even after contact from their provider, we try to identify and reduce barriers to improve access and compliance by enhancing care coordination. However, this is a complex problem. Why is this hard? Data is messy and comes from a lot of different sources, including patient medical records and billing records, and transcripts from the care coordinator. Data is often dirty, missing, or incomplete, and requires expertise in the area it came from, such as medicine in this case, to understand its meaning. Second, it's difficult to define what is best in healthcare because that's different for every person or organization involved. Private companies want to maximize profit. Patients want the best outcome for themselves. Healthcare providers want the best health outcomes for the population they serve. Every stakeholder in the process is going to have different priorities, and there are trade-offs to any solution. Third, we must take into account human behavior, which is complex. To do this, we partner with clinicians, computer scientists, and psychologists to identify barriers and motivations for screening. Hopefully, you see now that health is a function of individual attributes, but also many other factors. Let's go back to Ed from our opening scenario. He developed sepsis within a hospital. So let's say, as a researcher, you're trying to improve early treatment of patients for a certain condition, such as sepsis, within a hospital. What should you consider? Of course, the individual, like Ed. We should consider his medical record, medical history, and lab results. But what is the environment around him? Should you consider anything else? Let's peel the onion. What about other patients? They share a care team, so when a doctor is busy with one patient, another may have to wait. What about shared resources, like labs or radiology? Even factors such as a shift schedule can impact care, because doctors need to conduct rounds at the beginning of a shift and may be tied up for a while. Once I have the problem, the data, and systems identified, I use operations research, which includes applied math and data science tools. These are powerful tools and techniques that can handle complex data and problems. My goal is to use operations research to make recommendations that have a broad impact, inform health policy decisions, and reduce health disparities. The world you live and work in will be increasingly complex, but we can learn from it by gathering data and conducting the appropriate analysis. Having a solid understanding of the tools and approaches I've mentioned here may put you in a key position to help improve health outcomes for people. Ed, from our example, may have you to thank for creating an early warning tool to help providers save his life.